today's World Insight, the World Health Organization closes ranks in efforts to curb the COVID-19 global menace. The latest and key lessons from the WHO rep to China.
These graduated risk-based approaches have been well demonstrated across the provinces of China.
And a spike in confirmed infections outside China. What will it take to tighten the noose around the coronavirus? Here is our host, Tian Wei.
Hello and welcome to World Insight, coming to you live from Beijing. I am Tian Wei. Is the world ready to deal with spreading COVID-19 infections? World Health Organization experts warned this week that the world was simply not ready for a spike in COVID-19 cases. These were reported in South Korea and Japan, parts of Europe such as Italy, and in the Middle East countries, with Iran facing the biggest threat. In China, though, the rise in confirmed cases has slowed down. In Wuhan, the epicenter, the rest of the country is starting to see the long-desired goal of 0 new confirmed cases. But with more people on the road and back to work, with the exact nature of outbreak yet to be determined, can China take a breather? Dr. Golden Galia, the World Health Organization's representative to China, told me clearly in an exclusive interview Wednesday, all important measures have to go on. This is no time to relax. And clinicians. New vaccines.
The outbreak has changed dramatically. When we last spoke, the numbers of new cases that day were of the order of 2,000. We are now at a quarter of that level. In those days, we were discussing what did it mean as the epidemic started to decline. Now we see a continued trend since those days. And indeed, the numbers of cases being reported outside China are now beginning to be equivalent to the numbers inside China. It has shifted to 34 countries around the world, but at the same time, China has shown that there is a way of controlling and achieving a consistent decline. We are not over yet, and I'm sure we will have a chance to discuss this. There's no time for complacency, no time for declaring victory. We need to continue the work that is being done, but it is much better to be reporting on over 2 weeks of declining numbers.
If we think about the current situation, the number slows down in terms of increase rate. It has so much to do with what we did over the past 2 weeks and earlier, rather than what we are doing now, because the result of today will be reflected only 2 weeks from now.
Yes.
But look at today, Dr. Galia. People are coming back to work. There are much more people-to-people interactions. We also see shopping malls, streets, public parks, even scenic spots now have more people, if not crowds of people. What kind of warning signal does this send to you?
On one side, one does not want to cause panic. The epidemic is showing community transmission in Wuhan, and efforts are being made to control and mitigate the situation there to reduce the impact on families and the people affected, reduce the suffering, produce the best care and public health measures that is possible. Outside the country, all the evidence that we have seen points to clusters within households, and there's very active containment being done by very intensive case finding, very searches for people and testing of people with influenza-like illnesses so as to get a sense of whether there are community transmission. So for the time being, it appears that the transmission that is happening outside Hubei is more contained in people whose chains of transmission can be traced. So people do have, there is a lot of wisdom to seeking to restart the economy in a gradual fashion, to get schools back in play at some point, to get workers back to factories, having and offices. That is all understandable. People should not mistake that this return to some measure of normality and economic activity is saying, oh, we've won. The virus is still around. There's a huge imperative that people should keep protecting themselves, keep washing their hand hygiene, their social distancing. I think it is premature to be thinking of the same level of social and entertainment, for example, behaviors before the epidemic is clearly better under control, until we see an even lower level of decline. A gradual return to normality. We do know the vigilance is still there, and that each individual case, as it is discovered, will be very quickly isolated. We know that there are beds that have been put in surplus, in readiness should there be another outbreak, but people should not be falsely reassured. That is a danger which can lead to some resurgence in the numbers.
Let's divide the issue between Wuhan and Hubei and the rest of China. Yeah. Dr. Gallia, there has been extremely strict social distancing policies implemented in the epicenter of Wuhan and in many parts of Hubei. However, we still see, after almost 1 month of those policies, the situation is better, but new cases, particularly in Wuhan, are still popping up. Whether social distancing is the best way to do. The reason I'm asking this is not because we can turn back the clock, but rather what China can do now, or has been doing, can be of reference to the rest of the world, which are still now experiencing the very early stage of an outbreak.
The WHO China joint mission has just ended its work, and they made it very clear as they went around and looked at the situation in different provinces, in Wuhan itself, in Beijing, in Sichuan and Guangdong, that there is no such thing as a single China approach. That there are different patterns of the epidemic, and in Wuhan itself there has been community transmission of the virus, and so this is a process that they have said publicly that with the process of the lockdown in Wuhan and the social distancing generally in China, hundreds of thousands of cases have been averted. The force of infection, the rate at which the number of cases was rising at the beginning was so fast that it would normally have taken much longer to reach the peak. So yes, of course, one can see the cases that there are now, but at the same time, these are demonstrably much lower than they would have been if measures were not so strictly put in place. When the members of the mission returned, they reported that as they visited a fever clinic, as they did not see any patients, that it was very important to keep, even for them, a distance and to have indirect visits. But they were able to hear reports from frontline workers that the numbers of cases have started to decline to a level where they can start to plan about how to provide care better. They can move patients. There are some open beds. Yeah. So there is, yes, the numbers increase, and Wuhan and Hubei still are still the epicenter and still account for most of the new cases in China. But at the same time, there is a measure of control already appearing there.
But the question really is, Dr. Galea, how long can the social distancing policy, particularly very strict social distancing policy, be sustainable? There are other health consequences, as you may know, when you have people confined mainly at home. So, not to mention psychological issues. Of course, saving lives is still the priority. People want their lives, so they still stay at home. But how long can this go? This is also a very crucial question now, because we have already seen budding symptoms of people who are suffering from other health consequences of this policy.
And already there, I could see both the cautious optimism, as I called it at the time, the strength of the frontline health workers, as well as the somber mood of the public health people as they were seriously understanding how rapidly this virus was spreading. That perspective still is very much alive with me now. Rather than understanding, I can only imagine what stresses people are under as they are isolated for a period of time. I can also understand how if people are still getting pregnant or still need antenatal care, people with diabetes and high blood pressure need to have their regular checks and to have their treatments. As the weeks grow longer, these stresses are surely there. One hears reports of alternatives being offered, such as virtual hospitals and internet-based services to appease some of those difficulties. But I can only say that we respect that sacrifice and we hope it will not be too long. What we have seen is that different policies are being implemented or relaxed based on a very strong scientific basis of risk assessment. Looks at the declining numbers and can only hope that they will continue at such a rate that the pain will not be too long. But it would be very dangerous to try and make any prediction. It could set up false expectations.
While China is holding the front line against COVID-19, other places have to deal with a surge of cases there. How can they get prepared? Looking at the realities, prepare for the worst, to do it fast, make sure it is not just sporadic measures, but these are in-depth and get the whole society mobilized. Golden Galea, the WHO representative to China, told me all of the above based on China's experience. These are measures other nations can learn from and certainly use as reference. Will the rest of the world, as we have witnessed, more likely to be resembling the cases of other parts of China, quote unquote, or the rest of the world could also see the danger that could resemble the situation of epicenter of COVID-19?
China has shown how to achieve a decline and a reduction in mortality and improvement in clinical outcomes. That has been now fairly amply demonstrated.
What are these, to you, the most important factors?
Being ready.
Okay.
Active case definition, active case finding, contact tracing, isolation. If there is any indication of clusters, you have to very aggressively go after the clusters. Any indication of community transmission will require broader containment measures, work stoppages, stoppages of mass gatherings, stoppages of the school. Getting the doctors and nurses, the healthcare workers to be already equipped and trained, high index of suspicion, to be actively testing people with influenza-like illness and severe acute respiratory illness, pneumonias of unknown cause or etiology, to be actively looking for the cases and the virus. With such levels of readiness and the willingness to activate an all-of-society approach, such as has been seen, that it is possible to build up a graduated system from the containment of a mini outbreak in a household to a more community-based approach. Also, to be ready not to be surprised, to increase the capacity within healthcare system, the extra beds that are going to be needed if there's a larger outbreak, the infection prevention and control procedures that need to be readied. These graduated risk-based approaches have been well demonstrated across the provinces of China. Indeed, we do not say that there is a China approach, but the China approach is, and these serve as good models for what other countries could do.
Now we see, Dr. Galea, that outbreaks are taking place already in South Korea, Iran, and Italy. Meanwhile, there are increasing concerns in Japan and also in even some of the continental European countries, and the United States, North America also, together with Canada, have some cases. The question really is, how much do we know about the strains, the virus strains, that were earlier discovered in Wuhan and other parts of China, vis-a-vis the virus strains in some of the other countries? Of course, they could also be different from one another. How much do we know about this so far, scientifically speaking?
In summary, people are being quite generous in uploading and sharing the genomes of many of these different viruses isolated from many of these different outbreaks. And as you look at the family tree, the phylogenetic tree, as it is called, of the viruses, up to now, all the ones that have been published all come from the same trunk. There's enough relationship between them to say that they are generally all referring back to the same source. We don't have, these outbreaks are not another disease completely, or a different strain, or a dramatically different strain of the virus. Yes, there are genetic differences that small changes are natural as the virus gets transmitted from one person to another, but the behavior, the sequences are all showing the common connection.
Dr. Galea, China now has already come to a certain stage of prevention, control, treatment, and many other things. But there is an increasing danger as other cases are developing, particularly in the neighborhood. How much of a danger of imported cases into China now, with South Korea, Japan, for example, and you never know how other international travelers would bring the potential of the danger. Dr. Galea, to you.
In a way, this is the same question as other countries were asking about China before, and it is answered in the same way. There has to be a risk-based approach, assessing what in the other countries, what is the pattern of transmission. Is it still cluster-based? Is it still traceable in terms of routes of transmission from, or the path of transmission from one person to another to a known case? Or is there community transmission? The same graduated approach needs to be followed in those countries as was followed in China. And China needs to continue its vigilance. There are many possible ways in which the virus could be resurgent. There are households in China that still have it. There's the community outbreak in its late stage in Wuhan. There are the possibility, as people return to work, of small resurgent numbers, and there is the possibility of reimportation. All of these remain a reality. The good thing is that in China we are now seeing a heightened sense of alert across the whole country, and the same applies, the same advice: active case finding and active contact tracing to limit the impact of any re-imports.
That's my interview with Dr. Goldengalia, WHO representative to China. Tomorrow we'll bring to you another part of our interview, more about his insight into the issue of statistics and numbers. So stay tuned. You're watching World Insight with me, Tian Wei. Still to come on our program. A spike in confirmed infections outside China. What will it take to tighten the noose around the coronavirus? A word with two experts in Europe, particularly about the situation in Italy, right after this break. Welcome back. This is World Insight. I'm Tian Wei. The new coronavirus, or COVID-19, has spread far across Asia, reaching the continent of Europe, where nearly 400 cases have been confirmed. Austria, Croatia, and Switzerland have confirmed their first cases on Tuesday. Germany and France have both seen over a dozen people infected. Italy has become Europe's worst affected country, with over 300 cases and more than a dozen deaths. Many public events have also been cancelled in an effort to try to contain the virus. Changes have been made to the Serie A and also the Europe League games, with some behind closed doors without fans. A meeting between French President and the Italian Prime Minister was also cancelled. But on Tuesday, health ministers from France, Italy, and Germany, as well as the EU Commission, committed still to keeping borders open. For the latest on COVID-19, joining us in Rome, we have Francesco Sisi, who is an Italian author and also columnist. In Brussels, we have Johan Knights, who is the president of the International Society for Antiviral Research. He's also a professor of virology at the University of Louvain in Belgium. I hope I pronounced all of these names right. Gentlemen,
absolutely.
Thank you, sir. Gentlemen, let me begin by asking our Italian guest first. Mr. Sisi, thank you so much during this crisis time still be able to join us in this discussion. What have been the reactions from the public in where you are, Rome, and other places in Italy about the lockdowns?
I think people are scared, and there is a sense of panic. At the beginning, the government tried to perk up attention, public attention, but the result apparently has been there is too much attention, too much fear now, and recently the government is trying to tune down the awareness, the public awareness. But definitely people are very scared because nobody knows exactly how the infection, the cluster, the first cluster began, and we have cases all over the places, and we don't have a clear chain of connections. So people are worried, but I would say in recent hours, the number of increases in cases has been slowly declining. We don't know what is the reason, lots of confusion.
I see. a lot of confusion, and some suggest the panic as a result of the government trying to calm people down. But what is likely to be the latest measures? For example, people try to get themselves protected through face masks. Do you have enough supply of that? There are other details about the food supply as well, and also the relations among localities in Italy. Some have been more severely influenced by the COVID-19, others do not yet. So how to see this relationship under this very strained circumstances?
Yes, it is still very confusing, as you said. Some places, some localities in Lombardy region have been under quarantine. However, the enforcement of this quarantine, it seems to vary, as the measures approved and applied by the different localities vary as well. In Veneto, there are some measures, in Lombardy, different measures, in Piedmont, different measures again. We have seen some kind of friction also between local government and central government. Everything seems to happen very fast, and as Italy seems to be pretty unprepared. We have an early warning. Unlike other countries, we realized the situation was very serious and the people reacted fast. But now that things are starting to sink in, the reaction is not really coordinated so far. We hope for the best in the next few.
In circumstances like this, nobody can be 100% prepared. This is just a 100% fact, I guess, because it's an epidemic and the nature of it is spreading fast. That's why we also want to invite the expertise of Mr. Nates joining us, because you've been doing research about virology, and therefore, what is the latest situation? If I could ask the other expert joining our panel as well. What is the latest situation Europe-wise? What about the EU, for example? Have been any policies out for countries to be able on a united front? Mr. Nates?
Well, I think each country has sort of its own policy, but of course there is a lot of communication within Europe. I must say I'm not a public health expert, but what I hear from colleagues is that there's indeed at the European level quite a bit of communication with the top officials. But of course each country also have its own governments and its own decision making, and so this may indeed be different between, let's say, Italy and Germany.
Okay, well,
okay,
yeah. But you know, to your expertise, because you've been doing research, academic research about virology. So tell me about how strong is the European strength in terms of researching about the virus and also be able to advise public policies based on the degrees of research that you've been having so far?
Yeah, I think we all learn a lot from what we see in China, and of course as researchers it's not just us in Belgium, it's not just us in Europe. I think it's all virologists around the globe that are looking into this, and definitely also in China. So I was in September, I was in Wuhan basically at a international conference on virology, and you have excellent virology labs in Wuhan and in other places in China. So there is a lot of communication, of course, between experts, between virologists about this virus and about how to tackle it. The point is, of course, that in a situation as this one, that we are left basically without any weapons. I mean, the only weapons that we have is putting people in quarantine, putting cities like Wuhan, which is quite an effort and is applaudable, in lockdown, which is also happening in its smallest cities and villages in Italy. So the point is that if you have an outbreak with a new pathogen, as we're seeing now, that it should basically, as human mankind, not just as Europe or as China or as United States or Japan, but as human mankind, we should altogether be better prepared for that. And I have been, together with some other experts, been saying that for years, mankind is not prepared for this new outbreaks, what I call the expected, because you may expect to happen it, unexpected, because you don't know which virus will basically suddenly appear. And so what you need is, of course, you need technologies to develop vaccines very rapidly, and Europe is funding this, and China is funding this, and you have organizations like the CEPI, the Coalition for Epidemic Preparedness Initiative, who are putting money together to do that. And so that's good. I mean, you need platform technologies that allow to rapidly develop a vaccine as soon as you see a new pathogen emerging. But the point is, you will always be a bit too late. And I mean, we could not, the teams in China, put the genetic code on databases on the 12th of January. This was quite an effort. They got that so quickly done. So based on this genetic code, we and others could start working on a vaccine. And but still, as the director of the WHO, Dr. Tedros, said a couple of weeks ago, 10 days ago, something like that, that it may take about 18 months before we have basically a vaccine produced to sufficient quantities to vaccinate a lot of people.
Exactly.
And to help using the vaccine to stop an epidemic. And that's problematic, because we would need such a vaccine now. The point is, you cannot make a vaccine if you don't know your enemy. So you can only start doing that, in this case, on the 12th of January.
Mr. Nates, as you may know, our program earlier, over the past few weeks, have been interviewing some of the biggest names in the field. For example, President of CEPI, as well as President of European Research Council, which are providing funds for basic research about medical issues inside your continent. But as we know, there is no faster solution when we face an epidemic like this, an outbreak like this. But this does not mean that we could not have future cooperation in order to prevent some of the lack of information and knowledge. Having said that, though, Mr. Nates, now it's about the emergency. What do you think, from an academic perspective, can be done, even about the quarantine, even about how different countries and regions are doing the quarantine, how understanding of the virus would help public policy makers be able to make their decision, and how should those decisions be implemented with the academic aspect bear in mind? Mr. Nates, if you could explain to us about that more, because vaccines is already being developed right now, even though we're still far from it, but now it's a crisis that we're talking about days and weeks that we have to handle it.
Yes, but that's basically part of my understanding of the whole situation. We should have had vaccines, so we don't have them. So indeed, the point is, you need basically in any place around the globe to try to implement what China has been doing until now. So China was basically, and this would have been the case in any country, in any region, if something suddenly emerges, you're taken by surprise. And so I think China did right away the right thing. And I think we all have to learn basically from what China did. The question is, of course, if you have to put a big city, take London or Paris, which is about the size of Wuhan. I mean, if you have to put such a city in lockdown, will that be possible in Paris? Will that be possible in Rio de Janeiro? I don't know. I think the situation is evolving, but we should. I mean, social distances are important, as you explained, and Dr. Gallia explained. I think a lot of measures that have been taken are being taken in China. Should be implemented as well in Europe and in other places.
Yes.
I think
but of course, Mr. Sisi, if I could go to you now, a lot of things Dr. Gallia also said has a lot to do with seek truth from facts, which is quite a China principle in a way, because every locality, and in this case, every country, has to look at their own circumstances and check the reality when it comes to the degree, and therefore decide on the measures of the degrees. So, Mr. Sisi, to Italy now, which is now apparently an epicenter on the European continent, what do you think is the reality? To what degree, as a media worker that you've been talking to around the society, should be the reactions and pragmatic reactions?
Well, the reaction, what should be the pragmatic reaction? This is a very good question. And because, as you know better than me, Italy is different from China. And
Certainly.
It's hard to confine Italians the way Chinese accepted to be quarantined. This is the first reality. Unfortunately, the quarantine, it seems at least that the quarantine for those localities around Lodi, which is the epicenter, the cluster of the disease, didn't work as well as it was hoping. I mean, people were hoping. So we have cases now in Sicily, perhaps one in Rome, and we have to think that cases could multiply in the next few days, the next few weeks. In theory, yes, a measure of quarantine, hard quarantine, should be put in place, but because of Italian society and the way Italians are, this could be very hard to implement. Moreover, we have...
Go ahead, sir.
Yes, sorry,
Moreover,
I was too long.
Go ahead.
No, moreover, I think there is a similarity between China and Italy. I mean, the problem is also how to try to contain the virus, but also not to kill the economy. The virus has hit the most productive part of Italy, Lombardy, Veneto, Piedmont. So the economy of Italy could suffer greatly, and if the economic outcome, the economic backlash could be even worse than the disease. So the government is trying to have a balancing act here. It's going to be difficult, I'm afraid.
If I could just follow up about that. I mean, you are now living in Rome because you're sitting in the studio right in Rome talking to us. Tell me, as a citizen there, what access do you have to when it comes to food supply, life supply, and also Medicare possibilities? For example, is hospital being mobilized and specialized in order to set up fever clinics? For example, whether special beds have been putting aside in order to cater to any outbreak if it happens. Hopefully it's not happening. I'm knocking the wood right now as I speak this. But still, Mr. Sishi, what about that part, the medical side of the preparation?
From what I hear, I mean, I'm no specialist. From what I hear, there has been a preparation there. Hospitals are somehow ready. There's been already an account of how many beds could be available in cases like this. I would say that at least in Rome now there is no panic buying. I mean, both pharmacies and supermarkets are fully fully prepared, full of stuff, and people in Rome walk and live as normally as they were before. The number of cases is not huge compared to the availability of hospitals. So far, the situation is still under control. We have to follow closely, of course, because the outbreak has been very fast, the propagation has been very fast, so we don't know what will be the situation in the next few days.
Before we go, final question. I want to address that to Mr. Nates. From your perspective, whether border control works, because WHO would never prescribe border control or travel ban, but for Europe, border control should never be the issue. But now, in epidemic, what does it mean to you?
Well, I mean, you have to live in Europe to see how things go, and it's really difficult. I mean, they have all these small little countries. I think it's really difficult to implement border control. I can just take my bike and I can bike to the Netherlands, or I can bike to France from here. I don't know if this is doable. I mean, for a while it may have an impact, it may delay things, but I mean, a virus is spreading, a virus is not looking in where the borders are. It's just happening, and it's going to be difficult. I think I see this spreading. This will be spreading in Europe. This will be spreading other places in the world as well. If I can, so if I just can make further comment, I think a lesson that we should learn from this is that, as I said, I mean, we don't have vaccines, and in the interface, or the time between an outbreak that begins and having a vaccine in, let's say, 18 months, you would need a drug to treat the most sick patients, and also to help to prevent doctors and nurses from becoming infected.
Yes.
And this is something that we need to do for the future to really be prepared. Have, for example, drugs that are active against any coronavirus that we know, but we also know other families of viruses.
No.
And this is something, this is a lesson also from this one. We should make sure that in the future that you can, from the very beginning of an epidemic, imagine that you had, after 150 cases in Wuhan, that you had a drug to treat, that you had a drug on the shelf to treat people with this coronavirus infection. Would never have had today 80,000 cases.
Okay.
You would stop it basically from the beginning, and this is what we need to, a lesson that we need to take from this, I guess.
We would love to talk to you further about this, but of course this is the issue that's already been repeated many times. We'll see how we're going to do this time to see how we are going to be prepared next time. Thank you so much for all the facts and info. Johan, Nate, Francesco, Zishi, thank you so much, gentlemen. All the best to your country and to your people. Thank you. That's all the time we have for today. If you'd like to see more, you can find us on the YouTube channel World Inside CGTN, and then you can also find us on our Twitter and Facebook accounts. I'm Tian Wei on behalf of the team. Thanks for watching.